sequential answer. You know, you say, okay, how are you today? Well, I am fine. How were you yesterday? Well, I had this, this, and this. Okay, it's sequential. When they're talking in sentences, the sentences make sense. Okay, that means that they have a good level of consciousness. We can do for orientation. You can ask them what their name is. Where are they? And what year it is. Don't ask them what day it is. Don't ask them the date, because generally they don't know. Even a person in the hospital, after 72 hours, they forget what day it is.
I don't even know what day it is.
There you go. Orientation times 2. Okay, so that's what we're doing. Okay. One thing that I always do, and is that when I introduce myself to a person, I automatically reach my hand out and shake hands, or I touch the other individual. What that does is it makes now a connection that we are not in there to see the appendectomy. We are in here to see Ingrid. Okay, and that's important to do that, because they're known as the appendectomy. They're not known as Ingrid. Okay, and you have to be able to do that. Again, when you are interacting with clients, always title and last name until they tell you that you can say otherwise. Just give them that respect. They're called first name, they're called grandma, whatever else in the facility. And a lot of times it's because of familiarity. You don't have that. Okay? Until they give you permission to do otherwise. Title and last name. And you will find a lot of people, when you do that, when you address them that way, watch their face. Their expression changes. Oh, I got respect. Those little things. Okay. All right, so you come in, introduce yourself, and then I'll say, I'm going to do this assessment. I'm going to do a physical assessment on you, and so I need to touch you. Is that okay?
Yeah.
All right. And if I need, I'm not going to be anything invasive, but if you get uncomfortable anytime, let me know. Okay? And so when you get ready to start something, explain to them what you're going to do. Don't just come in, hi, how are you? Okay, no. Tell them what's going to happen so that they're prepared for all this. So I'm going to stop top of your head. I'm going to go down to your feet. Okay? When I'm checking the hair, I'm looking for shine or sheen. Okay, that says it's healthy. I'm looking at as much as I can at the scalp. Do we have excessive dandruff or not? Okay, excessive dandruff is abnormal. Okay, little dandruff, that's fine. That's see, most of us have it in the long-term care. Dandruff is common for the fact a lot of times that shampoo residue not something on their scalp as well. Okay, and then all you do is you feel the hair, or you get a little tuft of hair, just you roll it between your fingers, and it should stay intact. Okay? If it doesn't, that means that we have an issue with minerals or vitamins or whatever else is going on in this person. The hair is the first thing that tells you there's something wrong. The other point I want to make right away is that when you're doing an assessment, you are looking for normal. You're not looking for problems. You're not looking for lung sounds. You're not looking for weird heart sounds or their eyes bugging out in different directions. Okay, we're not looking for that. We're looking for normal. And if you look for normal, abnormal jumps up and slaps you right in the face because it's not supposed to be there. But if you look for abnormal, you tend to miss things because you're looking for one particular thing and you don't find it. But if you look for that normal thing, anything that's not supposed to be there pops right out. Okay? All right. So, I've done that. I'll look in the ears. On the ears, always making sure there's nothing growing out of them. Okay, we're not looking inside of them. And then I will look on our face, and we're just looking for symmetry. We're not looking for Picasso. Okay, eyes have to be on either side of the nose, not on one side. Can you raise your eyebrows? Okay, look mad. That's pretty good. Okay, close your eyes tightly. Okay, you can open it back up. Smile. Okay, should be happening on one side, should be happening on the other side at the same time, okay? It should be doing that. All right, now I want you to hold your head still, and I want you to follow my finger with your eyes, okay? Now you see, as I'm doing this, I'm not going fast, I'm not doing this. Okay, it's nice and easy. When you come to the edge, you stop. Come to the edge, you stop. Okay? All right, now, you stop on the edges because if they have any weakness, you have what's called nystagmus, the eyes will wiggle. In a normal person, they do not. And we're looking for normals. We shouldn't see that, but if you happen to see it, that's caused by a variety of different things, but that's not supposed to be there. Now, the accommodation, you were taught a couple different ways. You're told to look at something out here, and then to look at the finger, look back and look, and this does the same thing. Is an accommodation is that the pupil of the eye changes. When you look far away, it opens up broader so it can get more light in so you can see better far away. And when you look close, it closes up because you don't need so much. So when I do this, her pupils constrict. That's called accommodation. Now I want to check her eyes. If I don't have a flashlight, I have her take her glasses off, and then I can hold a shadow over the eye and then pop it up. Now the reaction is very tiny. You're not going to see it where it closes up and opens real wide. It's just a little flip, okay? And I do that about two or three times. I'm looking on one side, and as she's doing that, I'm looking at the pupil, and then the next time, I'm looking at that pupil, covering this side, because the eyes work in stereo. Somebody from Washington, D.C. Probably the president, but who cares? They work in stereo, so when I do the cover the other eye, I look on that eye and I look the same thing on this eye. Okay, just to see if they're reacting. So we have that in Perla now. Pupils equal, round, and reactive to light and accommodation. Okay. Come down to the nose, to the middle of the face. Can you breathe out of either side? Just have them do that, or have them hold and see if they can breathe. Serves two purposes. Is it normal? Breathes to both sides. And now we know if we have to do a procedure, we know which side to go through because one side's open, one's not. Does that make sense?
Mm-hmm.
Okay. Now you need to open your mouth. Anyway. I won't. Okay. I go to my dentist later on this afternoon. You look at the teeth, make sure they're in good repair. It doesn't matter how many fillings they have, okay? They need to be in good repair. You need to have moist mucous membranes. The mucous membranes, your gums and the cheeks on the inside of your mouth should all be the same color. And they should all be moist. Your tongue may or may not be the same color. But if it's uniform in color, it's normal. Okay? If you have bumps and ridges on it and so forth, that's okay. It's called a geographic tongue. That's a normal variant. Okay? All right, so I'm not, now this is just a simple assessment, so I'm not going through a full detailed thing of anything. Can you put your ear to your shoulder, your left ear to your shoulder? Okay, the other side? Okay, back, forward. Okay, look in that direction. Look back over here. Okay. Now I need for you to raise your shoulders. Okay, one more time. Okay. The thing to note is that when we're checking for their strength and so forth, it's not a contest. Okay, it's not who's stronger. Can I hold her shoulders down? No. All we're doing is we're putting enough pressure so when she raises her shoulders, can we feel that they're both coming up at the same time? That's all we're doing. We have the same strength on both sides. Okay? Arms out. Okay, push up. Okay, down. In. And then out. Okay. Raise your arms for me. Back down. That. Okay. There you go. And then I'm just going to check the pulse. And then I'll check the other pulse at the same time. history, the person has a history of congestive heart failure especially, because it can be different, depending on their circulation, how low it is. Okay. Now, what I'm showing you is a sequence that I take. Some have taught you to do all the trunk and then do the extremities and so forth. This is my fashion, the way I do it. And I take out my brand new free stethoscope. I got that at the conference. I did. It was we had a test, do a test on stethoscopes and see how good they were. Okay. With the stethoscope, you always use the diaphragm at this point. Later on, you'll be using the bell, but right now we just use the diaphragm. Okay. I'm gonna check your heart. Just breathe normally. Okay. Yep, you got a heart. Okay. 2 places to check the heart. There's actually 6 places to check the heart. Okay. On a physical on a simple assessment, what I do is I check up here. Okay. Generally, I check over here, your mitral valve. Say, okay, do I hear, or over here, do I hear it or not? And then the best place to check for your overall heartbeat is apical pulse, which is a 6th intercostal space, which is just above her bra line. Okay. So if you have a female that you're doing it to, you can have them move things out of the way. Like our patient, I said, I need to check your heart, so, I need to, and she goes, whatever you want, sweetie. Let's have somebody else come and do your assessment. Okay. Next, I will check for breathing. Take a deep breath, and out, again, and out. And I tell them in and out, especially with the older people, because they're at the outside, take a deep breath. Okay, out. Okay, tell them in and out. And you want to do all your spots, put them in front. On a woman, when you come down to the breast, you're done. Okay, you're not going to be able to hear very well through all the tissue. And then you come off to the side. Can you raise your arm for me? So you come down from just above the clavicle, and you come down just to above the breast, and then you come over to the side. At about nipple line over here, and then have them breathe again. Okay? And when you're doing that, when you check in your breathing, you check one side and then the other, because you're actually comparing both sides as you're listening. And you do that on both sides. If you'd stand up for me, I'm going to get your back. Okay. Okay, this way. We got to see you. Okay. You're not filming. When you're checking on the back, is that we have your spinal cord here, and we have the scapula, okay, on either side. So where you want to check is in between those. So you have a space about 2 fingers width in between those. If you want to make it broader, what you do is have the person cross your arms, and that opens it up to 3 finger spaces. Okay, gives you a little more. So again, we're starting at the top. We're in the book it says here. Normally what I do is I just go to certain points down, but again, I'm going from one side to the other, and then I end up again back under the arms. Okay. You may sit down again. Thank you. It's in those spots you will hear very well. When you're getting your skills check off and so forth, you want to make sure you hit all those different spots. When you have to then deep breathe, make sure that you pace it. Breathe in, breathe out, breathe in, breathe out, breathe out. Now they hyperventilate, they're going to pass out on you. Okay, so give them time, and then check all that just to make sure that's all clear.
I was just curious, how come they have us check so many areas? I don't even see doctors check that many areas.
They don't. That is a very, very thorough check of what we're doing.
Okay.
When you have a physician that does a full physical assessment the way it's supposed to be done, they do the same thing. Okay. Now one thing that I hadn't done when I was doing the arms and that, which I will do now, is I will check your hand grasps. Okay? I cross my arms when you do the hand grasps. Not the patient, but the nurse. The reason I do that is that we have a dominant side, whether right or left. And when we the dominant side than the non-dominant side, but we don't realize that. So, oh, it's a little bit heavy on this side, or maybe not, I don't. So what you do is you cross your arms, and now your right arm does not know where it is. Basically. You have now confused the nerves. You have, by doing this, you have confused the nerves. And now you have them squeeze your fingers, and now you get a perfectly clear picture of do we have equal hand grasp or not. Okay? And also prevents us from competition again and all that. From there, we go down to the abdomen, and on the abdomen, we just cut it in quarters, and you check each area. Okay? You auscultate first. On the abdomen, you always auscultate first. Always. Because once you touch the stomach, it's going to affect the bowel sounds. You're either going to lower them or raise them up. So you will do that. So it doesn't matter where you start or what direction you go, but make sure you cover each spot. Okay? And then just listen long enough until you hear that noise. A normal bowel sound, by the way, is 1 every 5 minutes. But you don't want to take that time with your assessment. If you don't hear bowel sounds here, but you hear really good bowel sounds over here, they're there. Whatever they are, just pass through over to this side. So you just listen just for a few seconds in all those areas. Okay, the genital area we don't check. And we come down to the legs and feet. Basically, all I would do is just to see, can they abduct and adduct. Okay, abduct means that they're going out. Adduct means they're coming in. And if you remember, add means adding to. That's toward you. Okay, so add is subtracting. So I have them do that just very simply, and then after that, I take them down and I check their feet. Do they have plantar flexion? Do they have dorsiflexion? Do they have medial lateral movement? Okay. And then finally, I will check the pedal pulses. To check the dorsalis pedis, is you come from the big toe and the next toe over, you have that groove in between. You start here and you come upwards until you feel where there's bone, and then press in. If you can't feel that, then what you do is you get your whole hand, bring it on the side of the foot, and then bring it until you come to that groove, and then stick all your fingers in there until you identify where that is, and then release the other fingers. You're not counting a pulse, you're just seeing if it's there. On the posterior tibial, you have the ankle bone. Just cut it like a clock, 12, 6, 9, and 3. At about 5 is where the pulse is. Now, if you can't feel the pulses, and some of the old people you can't feel the pulses, but they have sensation, they have movement, and they have warmth, they got a pulse. You just can't find it. It's user error. They're fine. Okay? Physical assessment is not complete. I make sure that she's covered up or back in privacy, whatever.